assessment of your federal agency in 200 days is a lot. And so one thing that we've really been working with agencies on, and I know some of you on this call have been working on it, is that this is both a sprint and a marathon. The sprint is this initial equity assessment that's in August. And so we provided guidance to agencies to really identify 3 to 5 focus areas for this initial assessment, and then also think longer term about areas that you want to go deeper into. And agencies are thinking through how to embed those longer term efforts into their first ever public facing learning agendas that will be published early next year, their first strategic plans under this administration, as well as their annual performance plans and their first set of agency priority goals under this administration as well. So a lot of that planning is happening right now, and hopefully, agencies are learning from their assessment efforts to then embed it into their longer term, areas to go further into, areas to take action in over the next couple of years. And then submitting all of that with their budget request in September of this year. So even though the action plan is not due until January, we obviously need to be thinking about it earlier so that we can make sure that those longer term hooks are really well utilized. So going back to the report piece of this, so we were asked to look at what are, the EO said best, but we're obviously, caveating that to be leading practices in assessing equity. And so that is obviously, as you can imagine, an incredibly broad topic. There's organizational equity assessments, there's equity assessments of how programs are administered, there's reviews of how do regulations impact different communities, there's questions of the degree to which different populations are adequately represented or accurately represented in data. And so again, like back to the way that USAID and the Peace Corps think about this is obviously very different than a certain component of the Department of Commerce, right? And so there's not like this magical list of 7 methods or approaches that are like how you approach equity, right? It's very much based on what is the policy area that you're even thinking about. Is it what type of function of government is it? Is it regulatory? Is it informational? And this is where we actually sort of looked at in our A11-280 guidance, we defined different types of federal services. And so thinking through like what's the type of function or service that your agency provides for which type of methods might be right for you. And then of course, there's just like completely different degrees of methods and approaches and assessments that have been used in different types of contexts, whether it's a city government, a local government, a private foundation, grant making process. And so, a lot to consider as agencies are selecting which methods they're using for their assessments. And so we also wanted to do something historic in the sense that, OMB has not necessarily in the past had an RFI sort of to this degree of just like tell us anything about how we could be doing a better job to be more to be more mindful of equity and equity impacts in the way that we make our own decisions as well. And so the goal of this listening process with the RFI was really just the start of the conversation. We're also fully aware of the fact that an RFI in and of itself is like not an equitable process. The whole mechanism by which you share information has its own access issues. And so it's just the start of a much longer marathon, as I mentioned. But, really want to learn about the best thinking in the field to support agencies in, how we work to address the needs of communities of color, women, religious minorities, LGBTQ+ people with a disability, rural communities. And then, the EO is quite broad and just sort of leaving it as underserved communities. So that obviously also means a lot of different things for a lot of different agencies. So, I think the responses are publicly available, so you'll be able to see what is submitted to us. It closes on July 5th, so closing somewhat soon. And then we're obviously already working on the report, but we'll try and reflect some of what we learned from that RFI in it. And we'll also be working longer tail here to build out resources for agencies. And if you are a federal employee, I'd really encourage you to check out the Max page that we have that's already been categorizing like all of the resources that we've been shared by all different kinds of like nonprofit organizations, advocacy organizations that do this work as part of their daily work. And so that is actually, I think, a pretty incredible resource for folks within agencies. There's like ways that no matter where you are in an agency, you can get started on this. And then we also have been doing a pretty robust learning community curriculum. So we've had a session on DEI a 101 for everyone, where we've had some pretty amazing professors from across the country walk us through even just how to use different terms, things that many of us feel uncomfortable about, like how to facilitate those tough conversations within your agency itself. We've had a number of sessions on leading for equity and how, in particular, those at the GS 14, 15 SES level can get started in their organizations, and that they as a leader are empowered to do. And have had a number of things on stakeholder engagement. We had last week, OIRA did a whole overview of existing clearances that exist and ways, and then also ways to design stakeholder engagement activities so you don't even need to get a PRA clearance, right? And like adding some clarification on that, because I know that that's always hazy for folks. And all of that is on the Max page, all the slides, all the recordings, any of the materials. So hopefully that's a good resource for you. We've had more than 3,000 people be attending those. I know the agency equity teams are quite large. We've also reached out to the high impact service provider community so that they can participate, but they are open to all. So feel free to share those with others as well in your networks. I'll pause there. I don't know if folks have more specific questions, but that just wanted to give a quick broad overview. And then if folks have questions, I'm happy to take them. I can't see the chat, so unfortunately, I don't know if anyone could read those if there are questions there.
Sure, we just got one in. What's the URL for the resource page you mentioned? And I think I just got an email from
equity at omb.eop.gov, reminding everyone there's a training tomorrow.
Yeah, let me see if I can drop one in the chat.
Yeah, I can send it out too.
Cool. Any other questions? Amira. So there's another one here. Amira, is this the performance section on Max?
No, I'll send out the link to Brian so he can paste it in the chat.
Okay.
Hey, Brian, this is Martha. I can't move my things around fast enough to get this question in the right place. But Amira, when agencies are looking at all the work they've done around customer experience, we've been trying to educate people on how to talk about the importance. And we actually asked Dustin this on an interview we did with PSC, the impact of using or how CX enables the adoption and the success of all the presidential priorities. This one specifically, since that's what we're talking about today, do you have any thoughts or words that you're using to, Dustin's response was, the use of customer experience methodologies and practices are obviously critical to the success of all of these efforts. So anyway, I just wanted to give you a chance to see what your thoughts are.
Yeah, I mean, I think you all can see even just like the place where a lot of this equity EO work is being driven by is our office, right? So I think there was like an acknowledgement that like, wait a second, the office that's trying to work with agencies on how they design better federal services is also the office that could help to coordinate some of this work on, more equitable services. And so I think that's really encouraging that I think we also have a really deep belief in how we work directly with folks at agencies and not just like at the budget office, right? Like it's not just the sort of center office that can drive this. It needs to be like deep within the programs and the frontline employees and things like that. And so I think, a lot of this work, if it's going to be successful, needs to be everywhere, not just like, it's really important, obviously, and we've seen incredible movements by the agencies that do have someone in the secretary's office that is like thinking about their equity assessment and convening an intra-agency team. And so that's obviously very powerful, but I think it's also really powerful to be thinking about it from the grassroots parts of federal agencies and how we drive this work from there as well. And so, yes, I think like the same practices that we use about like user research and customer research, and how do we make use of administrative data, and how do we use qualitative interviews and research methods like that will lead us to, and you know, in design, we talk about designing for the extremes, right? Like those are the types of things that will improve the equity of our government as well. And so we are definitely trying to make those connections, in particular through a lot of the learning events that we've done. We've had the lab at OPM do service design concepts with folks. We've worked actually last week when we did a session on you know, how to do stakeholder engagement under the PRA. We showed agencies how to use the A11 Section 280 clearance to align activities that they may be doing. So, and that clearance that we established for customer experience is like going to be used by agencies for a lot of their equity stakeholder outreach. So,
thanks.
Yeah.
Outstanding. So with that, I will, Amira, thank you so much. And I tell you, I can't, so giddy to fact that the CX team that's been doing all the work, you know, helping to, you know, establish a policy to A11, et cetera, are the ones, you know, that is actually helping to, you know, coordinate the activities around equity, and really, really powerful. It's a great example of building on past work. It's just like the fact that CX work really started back under, you know, the Clinton administration, and it's built from there, and it's built more and more momentum. And of course, we have a lot of leaders on this call that have been part of that process before it was cool. And it's so good to see this continued effort. So what I'll do is, thank you, if you could stay on, I know you have a busy schedule, but we're going to transition to the panel and really build on that, take from the policy perspective and kind of look at it through the eyes of HUD and HHS. So with that, I'll do a quick intros to our two incredible guests, and then Charlotte is going to be leading the moderation. So with that, just for everyone's awareness, I'm as Lee Becker, I'm privileged to be the industry vice chair supporting Charlotte, Brian, and Jennifer, and Martha, Crystal, the whole entire team. And we're so excited that we're having this conversation, connecting CX and equity together. So my distinct pleasure to introduce Ms. Michele Perez, who is the Assistant Deputy Secretary for the Office of Field Policy and Management at the U.S. Department of Housing and Urban Development, or as known as HUD. She has an incredible background, 25 years of field and headquarters level of service-driven agencies. Michele has led programs and operations across government, nonprofit, and philanthropic organizations. In February 2021, Michele was appointed as Assistant Deputy Secretary of the U.S. Department of HUD, Office of Field Policy Management. So she's a political, so we're excited, but she was one of us. Well, one of us has careers. She was one of us. So this is really special that we have that Michele was wanting to come back into government. But you know, if you think about what HUD does, and I'll tell you, it's truly powerful when you think about the amount of work. We think about the pain that's gone on with equity challenges, and where HUD has the opportunity that Michele is leading with trying to address those equity efforts is truly inspiring. FPM also provides place-based strategic leadership, direction, oversight, and support operational responsibilities for all the 61 regional and field offices across the country for HUD. Prior to joining HUD, Michele was the Chief Operating Officer at Tahiri Justice Center, where she led strategy execution, which supported immigrant survivors of gender-based violence seeking asylum in the United States. Michele joined Tahiri from the U.S. International Development Finance Corporation, where she served as VP of Management and Administration there, as well as Senior Advisor to Presidency of Diversity, Inclusion, and Engagement. And she also served at the VA, as a key advisor and consultant to both the VA Chief of Staff and the Veterans Health Administration's Assistant Deputy Undersecretary for Workforce Services. So really glad to hear, and she has some very personal, equity really means a lot to her at so many levels, how it's impacted her, and I'd love for her to, when she talks at the panel, to go through more on that. Now pivoting to Dr. Kristen Honey, who is the Chief Data Scientist and Senior Advisor at HHS. When COVID-19 pandemic hit, and that's where I've known Dr. Honey when I was at VA, but then I was just so inspiring to see her, how she I mean, just pivoted, at a dime, and really to help with the pandemic effort that HHS was so involved in. So she advised the White House National Security Council and HHS CIO on big data sharing, governance and analysis, predictive analytics, et cetera, work on a special project with of HHS Protect Vision with Data Robot. And in collaboration with the CIO, Dr. Honey established the Office of Chief Data Officer and co-founded the Data Governance Board to implement the Open Governance Data Act, elements of the Foundation for Evidence-Based Policymaking Act. This work with the OCDO is helping to unify the 11 HHS operating divisions across the board. So like CDC, NIH, CMS, FDA. Many don't realize that's part of HHS, but it's an incredible ecosystem with over 80,000 government employees, geographically dispersed across the country and some in the world too. Diverse mission and work cultures, bringing it all together to make sure that there's a single IT system, data-driven, that HHS is driven through that. As a chief data scientist, senior advisor to the Assistant Secretary of Health, Dr. Honey leads a $30 million COVID-19 diagnostic data platform project. So with that, I thought it was important for me to highlight the powerhouse of panel that we have here and showcase, truly the incredible work that the HUD and Health and HHS is doing around this. And so with that, Charlotte, who is our industry chair, so I work for her and I'm proud of that, will be leading the moderation. Thank you.
Please, that is crazy. You do not work for me. Hi, welcome everyone. It's so good to see all of your faces and presence. We have like a whole bunch of federal presence today, which is awesome. That was a great introduction. I guess we can just get started because I want to give them a lot of time to talk. Two of my favorite people in government. They are as remarkable in person as they will be on video today. So I guess, Michele, how are you? Welcome back to government.
Hello, I'm so glad to be back.
And Kristen, you have been putting up the good fight now from private sector and going through a lot of things. I'm super excited to see that we finally get a chance to talk about the thing we always talk about, which is DX. So I'm just going to get started with, I guess, Michele, if you want to start with this question. What public-facing services does your organization provide? I know that's an easy one, but the second part of the question is, does it have any historical challenges with diversity, equity, and inclusion that the agency is trying to address through trust and better experiences?
Yes, and yes, right? I'll start with this. I am so glad to be back where I started. So I actually joined federal service in 1999, and I joined HUD in the Chicago regional office as what was then known as a community builder. The idea being that when it comes time for services to be delivered on the ground to communities in need, particularly in crisis environments, do the community know how to access? Do they know who to reach out to? Do they know how to get help? And so much of HUD's work had historically been in delivering programs and compliance through our intermediaries that to a certain degree, we may have forgotten to a certain extent that the customer of our customer is also our customer. So the people who are the beneficiaries, the people who actually receive the HUD assisted housing vouchers or who live in and depend on the community infrastructure of parks or streets or things of that sort, that they too have a voice. And so getting the information to them in terms of what HUD delivers, but also taking the information back from them to give to the programs, the folks that are developing policy in headquarters was equally as important. And so coming back to HUD in this role as the Assistant Deputy Secretary for Field Policy and Management, I oversee the 61 field offices across the country, the regional offices, the field offices, the folks who are in effect the front door to HUD. And this conversation around equity, around inclusivity and belonging is so very important to me because this is quite literally what brought me back to government. This is a moment that is singular in that we are acknowledging and recognizing the degree to which the government and our government services broadly do and or don't provide this common understanding of equity and inclusivity. And for me personally, it's more than just, and I loved what Amira started off with, a recognition of what our policies and programs are doing. But for HUD specifically, I'll tell you, we took it a step further, because the executive order on racial justice and equity, in my mind, complements the memorandum. And I'm going to read it because the name of this memorandum that's quite simply targets HUD in the recognition that redressing our nation's and the federal government's history of discriminatory housing practices and policies, right? Redressing, not just acknowledging, not just identifying, but redressing. There are an entire infrastructure of housing programs that were deliberately, intentionally created to be discriminatory in nature. And what we have to do, where we are right now, is to uncouple them from what the intent, some malicious, some just simply negligent, and really recognize, where are they problematic? Why do they exist even? What's the history? And that's something that's important for our entire workforce to know, but also our communities and the people with whom we work are quite aware of. And so certain things we already knew, certain things we're learning from the communities we work with to better understand the impacts and its implications. But at the end of the day, trust and confidence means, first and foremost, recognizing and identifying the degree to which we have contributed to the place where we are today, and then taking stock of what we can actually do to pivot to a place where we actually recognize and understand how to make a positive and constructive difference. So I would say to you, this is the moment in time that I personally have been waiting for, to really run fast and run hard in support of the communities that we serve.
Wow, that was a lot of things to think about. I cannot believe they use the word redress, because diversity, equity, and inclusion can quickly become political in a way that people don't want to approach. So super fascinating that they did. I want to give Kristen a chance to answer this as well. I know that you have personal convictions that drove you to government, and on a sort of laser focused mission on Lyme disease and using the best of government and data to do these things. And I want to ask you what you feel like is the power of diversity, equity, and inclusion in trying to solve these problems, and how it relates to the services that HHS provides, and what considerations you take. Right, that was a lot.
Thanks everyone for being here at this Lunch and Learn. I really appreciate it. Great to see ACT-IAC friends. So yeah, I think of equity and inclusion really underlying everything we do in the health and human services space. So it really is not a one thing, but a every step and kind of a responsibility of all of us. So from where I sit, a lot of what I've been doing is trying to unleash data and responsibly share data with the pandemic. Obviously, there are many other applications, like Charlotte mentioned, with Lyme disease and many other health priorities. But with the pandemic, top of mind and really been the biggest response this past year. I think that the diversity and equity and inclusion has to start from day one. And that is an awareness also where we have gaps. And in the data space, we often have gaps with vulnerable and underserved communities. Either we don't, have insight into what's happening there. Sometimes people don't trust government. And if you don't trust government or institutions, you're sure not going to share your information willingly. And so there can be biases in there. So I really think of this, diversity, equity, inclusion as something we have to think of early and often, every single day, every single level. So how we've done that, part of that is with healthdata.gov, the home of US open data. We tried to do a parallel thing for COVID data. And with our enterprise-wide data sharing, created 4 principles for sharing COVID information, one of which was transparency. So it's privacy, security, transparency, and trust. And that was all about sharing information and hopefully making information open by default when we can. And then creating the space for people who maybe uncomfortable sharing their information to do so. And when we work in the open that way, one thing we've observed is you can see where the disconnects are between what the data say and what the community says. And if there's a real big gap, for me, that can signal that we need to focus there. We need more information. And then the role of HHS is often to create a safe space to figure out how to get that info. And often it's not us getting it, it's like partnering with groups that have been in the organization, in a community for decades, and they're gonna have access to it. So with this equity, diversity, inclusion, I think of it as everything we've done. It touched every aspect of this pandemic, from beginning to unlock it, what people were willing to share, what people weren't willing to share was really different. And then those biases get baked in. So I kept having my team look back at, okay, this is what the data says, but what are people saying? And having those tight feedback loops where you're really coupling, the challenges, the problem we're trying to answer with what data says, and then ground truthing that in an iterative way. It's very much ongoing. We're just beginning. And one concrete thing we did in the past couple of weeks in this space was to try to mash up data sets and put them on healthdata.gov that were already out there in the public, but not accessible, so that community members who might have access or be eligible for federal benefits, but they might not know it, or might be super hard to fill out the applications, or they might not be sure which benefits they qualify for. We kind of did this quick sprint with FCC and other colleagues and just said, let's pull all this info that's out there and make it easy for people. So I think that play of, diversity, equity, inclusion is about creating resources, digital tools, and information so that we're empowering Americans themselves to take that data and drive their own health decisions, or take that data and apply for benefits, or apply for whatever grants or services they might be eligible for. So a long answer, but it underlies everything. And it is not a one-time thing where we're done. We have so much work to do. And I think in our space, we try to layer this into intentionally at every step of our work process.
Thank you. I'm curious, both Michele and Kristen, and this wasn't part of the questions that were being asked, but is there, you guys have a lot of parallels, right? You have these like very critical things, right? Like it's like we can see it from the data perspective, we can see it from like the program perspective, but it's really, we're talking about getting people into housing and getting people into like getting medical services and things like that. So when we don't consider diversity, equity, and inclusion, and it's an afterthought, both of your agencies are the epitome of things that can go wrong. And so I know that there's certain segments of the population that are refusing the vaccine or have refused CDC guidances based on the lack of trust. And so watching that unfold was really tragic. And so there's a lot of things to build in trust. So when you are making these considerations, and both of you being the very like conscientious leaders you are, what kind of considerations are you making? Like and Kristen, you started talking about this a little bit, so maybe we can elaborate on a little bit. And Michele, like what kind of considerations are you asking? Are you like putting it into RFIs? Like, are you doing trainings? Like, what are the considerations?
I'll start only because I think we're in the midst of this right now. So what we know, we have a wonderful partnership with HHS and specifically with HRSA and the federally qualified health centers. And so these are community-based community health centers that have received a significant supply of vaccines, COVID-19 vaccines. And what we found is the mass vaccination clinics are no longer working, right? They're capping out in terms of folks heading over to get there. So the folks who have not yet gotten their vaccines are either unable to get there if there's an accessibility issue, or they are unwilling to go there because they don't trust the government and the provision of these of the vaccine. And so what we've realized in looking further at who in fact are living in HUD-assisted properties is that first and foremost, housing is a social determinant of health, right? There are a reason why these communities in particular have been disproportionately impacted by transmission, infection, and mortality of COVID-19, specifically communities of color, people who have low income, there is a true consideration of what is preventing them, you know, and is it a function of convenience? Is it a function of trust? And how do we approach all of that? And so one of the major targets of our partnership with HRSA was to micro-target, which is to say, where are the communities who don't have easy access to a federally qualified health center, who are greater than 8 miles? We know the addresses of our public housing authorities or multifamily properties that are privately owned but have housing assistance subsidized contracts with HUD, whether they're Section 202s or 811s, meaning people who are properties that are multifamily and or those who are serving seniors or those who are serving folks who are disabled and require additional service needs. Well, as a result of all of this, we can map where every single FQHC is and identify pockets, validating that against information from CDC and HHS to say, how do we help them? Because we know where they are, we know where there are disproportionate impacts of vaccine uptake. HRSA maintains the information of migrant and seasonal farm workers that are getting their vaccine at FQHCs. So too with residents of public housing and assisted housing. So too with people who are homeless and experiencing homelessness or at risk of homelessness. So for all these reasons, we can't simply sit back and wait for them to come. We need to assert that there is a need, there is a value in partnering, and we go out to them. So whether it's mobile vaccination clinics, whether it's working with local housing authorities to have vaccination events, engaging other community partners. You know, in the last 2 weeks, we've hosted, since the partnership, nearly 150 vaccine clinics and communities all over the country. We are expanding it. It's exponentially growing. We were already doing this work, but now we know exactly where to do it and how to do it. And so the run up to the 4th of July and the president's, you know, direction to get 70% of our population, adults, vaccinated, and the expansion of getting kids of greater than 12. I mean, we have the real benefit of saving lives with these vaccines. But even more importantly than that, I think, which is how do we prevent the impact of COVID to hit these communities the next time a COVID comes back, right? Another disease or another concern, flu, asthma. There are so many other impacts in terms of housing and health that if we are able to connect folks with a medical home, then we actually might be in a better position to prevent or offset the potential future devastating impacts, so we don't have to see what happened today happen again.
I wrote down
off of that, Michele, like the +1 and everything you said, and I love how you framed the micro targeting, because one thing that's been really clear looking at all our HHS data, which includes a lot of data from other departments and agencies, is that there is no one size fits all. And so the reason things are happening in one state or one community will be wildly different. And we see this in everything from, you know, vaccine uptake to why people are getting tested or not. I did a lot with diagnostic tests for COVID. And that sort of micro targeting is so essential because every state is so different. And within every state, the heterogeneity that public health in this country is not a simple, you know, we do one thing and it works across the board. So it really is about understanding the local community, where they're at, what their unique priorities are, and then building from there. In the COVID response, it's been a huge issue where a lot of our work, especially early on, was really at the county level. And, you know, we're moving so fast, we're pulling the data together for the first place. County level was the best we could do. But as we got more and more sources of information and we could dig a little deeper, a lot of that information was at the census tract level, so much higher resolution. So the past couple months, I've had my team really diving into how do we crosswalk these different data sets and try to dive down to the census tract level. And one reoccurring theme that keeps happening over and over and over again is when we have these counties, we look at them by counties, which are the most socially vulnerable, you know, counties. Within that, there's inevitably some really, really, really vulnerable census tracts. But then across the county or nearby, there are some really wealthy ones. So it averages out and you're missing huge parts of the population that if we cover it with a broad stroke, they look fine. So that micro targeting is so important. And we see that in the data from everything I've been looking at in the COVID space.
I was just thinking as you guys were talking about how both of your services or the focus of it became kind of like COVID. There's been so much activity on the ground and you completely forget like the essence of it, the word vulnerable, like it's like the definition of your mission. It's like getting your social security benefits and student aid and all those things. And all of them are obviously completely exploded upon impact of COVID, but you guys are really like in front trying to save lives, which is as real as government services can get and the most vulnerable. So I just want to thank you guys for all the hard work. Michele, you just came back, but I know that there's just been a whole bunch of stuff waiting for you. And so I'm sure you're super busy. And Kristen, I know early days of COVID, you barely slept and you were doing these like 17-hour shifts to go through data, which is just so incredible. I know many of you on the call right now experience the same thing. So just a word of gratitude for that. We have 5 minutes left, so I'm just going to try to combine the last question. And I am so disappointed that it's not longer, which is what effective strategies have you utilized to ensure accommodations for those who have disabilities or issues with accessibility, but also on top of that, the ability to identify unconscious biases and who's advocating for them. So like if it was like an ADA compliance thing for Disabilities Act, like who is advocating for that, who's been effective at doing that. And I think that other agencies who are represented here today would really like to hear like how you've gone about these very nuanced considerations.
Take a quick stab at that. So for my team, I try to have our projects go through a filter. The numbers and the metrics will vary by where you work, but the filter of, and this actually came from the Obama White House, are we going to impact $1 trillion market? Are we going to affect and improve 1 billion or more lives with a B? Or are we working on behalf of an American population that doesn't otherwise have an advocate or a voice? So a lot of that, when I work, falls in that last one of like working on behalf of communities that don't otherwise have an advocate or a voice. We do a lot of partnerships at HHS, for example, our Kidney X Innovation Accelerator partnership with an amazing group. They are the best, American Society of Nephrology. They are amazing operating the Hill, bipartisan support. They are very influential. So like in that say, kidney space, kidney care, they're good. But there are other communities like maybe long COVID, whatever it's gonna be, that don't have that voice. So that's a big filter. As I look at, where's there the need? Like where's a community saying they have needs? And is no one else picking that up? And then I try to really encourage my team from day one, early orientation, everything is including 508 compliance is the bare minimum, and building that into all the events that we do. So accessibility is like, like the feature of it. And the whole mantra, I mean, what it revolves around is just a firm belief, but it's not a belief because there's tons of science to back this up, that diversity strengthens us all, and really different perspectives and creating that space lead to better outcomes. It can take more time because you have a lot of different views to kind of wrangle, but what you come up with on the other side is much more robust and typically lasting. So in that space, especially when I'm working with technologists, either inside government or civic tech outside, I think of this, accessibility all as using our able bodies, our able platforms, all of our levers and access to create space for everyone and to be intentional about, ableism and like people not thinking about how it would be hard for others to join this, or how the colors we're designing with might set off migraines with this community we're trying to empower. So there's this ongoing use your power, use your voice, use your platform to create space for other groups to feel comfortable to speak up and be a part. And especially in the quantitative space, that has to come from us quantitative folks. It can be really intimidating to dive into AI, machine learning, statistics, but ultimately it's all people, and the data and the AI and the tech won't matter if we don't tell good stories. And if we don't have that effort solving problems that matter to the community, So it's that we need to expand the solution space, and then our job when we have positions of power is to like make the space and give that space to voices that aren't yet heard.
And I'll add, I think, sort of the reflection of that. So when an agency is empowered to do that and to behave in that way, one of the foundations that HUD is grounded in is the Fair Housing Act of 1968. It is quite literally the mission of HUD, not only to ensure fair housing enforcement, but also to affirmatively further fair housing, right? That's not something that happens on its own. It requires political, intentional, strategic will to make happen. And the way in which it happens, sort of reflecting back on what Kristen said before at the community level, is where a community understands where their respective constituencies and stakeholders are and actively invite them into the conversation to bring to bear all of the resources and gaps that exist within community and affirmatively demonstrate that they're just not avoiding discrimination, but they're actually pulling communities in to ensure that it is in fact an integrative, positive, constructive, engaged community that recognizes all of the different abilities that people bring to bear, and provides resources and supports to them in ways that they want and they need. So I would tell you on June 10th, we just issued the interim final rule at HUD on the provisions to affirmatively further fair housing, which was embedded in the 1968 Act and is now finally, I think, going to be in a place where we can blossom it, grow it, and actually implement it across the country in a way that's meaningful and significant. This is how we engage those who have no voice, who have been left out. This is how we ask every single entitlement for whom HUD receives funding to say to them, show us how you're doing it. And then we can lift up those folks who are doing a great job. We can provide technical assistance to those folks who needs additional support. But it is a level setting of expectation. And I think that is where we are today and the direction we need to continue to head, with phenomenal leadership on the part of the administration and our secretary.
Wow. I wrote down two things. Ultimately, all of it is for people. The tech and data won't matter unless it helps people. And using our power and platform to invite space. And then Michele, you said something around the same lines, which is actively invite them into the conversation, which ties us back to Amira asking the people. So I just love that it came full circle. And so I think I have to yield time for everybody to have Q&A. Just a reminder, we have an optional happy hour or lunch hour with free talk and networking, which people are the best and most honest selves at, and I really enjoy that. So please stay for that. And then Brian, if you want to moderate a Q&A. Thank you, Michele and Kristen. Hope you see you guys in real life soon. Brian.
Wow. I hope everybody's as energized as I am. Let's hear it. Does anyone have any questions? Feel free to unmute, or if you don't want to talk, feel free to drop it in the chat and I'll read it.
Hi, this is Sandy Mestre, and I'm driving, so it's a little bit difficult. I want to say thank you, first of all, for an amazing panel. I love learning. And I guess one of my questions is, as you're collecting this data and you're going out and starting these efforts, are there any type of trends, even though every state, every county is different, but are there any kind of trends that you are seeing in how you're collecting that information?
Let's see, this is Kristen. And one of the trends or the common themes I'm seeing come through is the importance of having the data scientists right up there with the subject matter experts, the clinicians, the people who are, trying to, who know the data. So like data is always in a context. And at the same time with IT modernization. So the IT modernization, the piping, the plumbing is done intentionally thinking about the data, but it can't be sufficient to leave it at the data. You have to couple that with the SMEs who know either the policies or the clinical context of the data. Because what we found, and I have a whole crew that I call the data detectives, these data people go out and they're finding all the reasons why data is getting dropped or lost is different at each place, but identifying that always requires like the SME in parallel with the data folks. And then together they can figure it out way faster, where we'd had SMEs working on issues for over a year. Like, why aren't we getting California data? California sending it. It was almost a year before we figured it out. But that marrying of the data technologists, and ideally data technologists who are plugged into an IT modernization project. So they're building the piping and the plumbing intentionally for as much automated data collection as you can capture. And then, that combined with the subject matter experts. And then each context will be different, but those quick agile touch points can really break through, months and months. In some cases, we're unjamming bottlenecks that have been there for years and people just gave up on.
And I'll add the relational piece onto it. So we looked at the data to start with our COVID a HUD HHS partnership to really find the folks who need access to information in order to make the best decisions for them and their families. And what was interesting is the data told us one thing, and to the data detective comment, we have staff in every single state, we have staff in all of our field offices who have pre-existing relationships with the local elected officials, with the community groups, with the nonprofits, with the local housing authorities. And I think this is the beauty of a decentralized national scale kind of an organization as HUD is, as so many other federal agencies are. Have we embedded in the community so that we are reflective of the people who live there and we understand we are residents of those communities. We interact with them. They know us. They trust us. We are not simply federal agents floating out there, trying to help. And that, I think that history and that relational piece of it makes it real. So where we found a community that may have had access, maybe we dig into it and found out that they didn't have the issues we thought they had, and we could introduce a whole new set of supports to those communities. So I just want to say it is critical for federal employees to really not simply be in the place where we do our work, but also reflect the communities that we serve, because we too come to this space not just as public servants, but as community residents. And that, I think, is an opportunity that has been one of my favorite aspects of working for HUD, that we are engaged and active.
Thank you.
All right, we have one more question in the chat. Are you working with NGOs or nonprofits to reach community members?
Yeah, I'm sure, HHS has very, very different models across the department. We're huge, as Lee said in the intro, 80,000 people with 11 operating divisions, including CDC, FDA, NIH, and they all work in different ways. So are we working with NGOs and academia? And absolutely. And the how is different depending on the problem we're trying to solve. So for COVID, we had a lot of detailees coming in from Johns Hopkins and expertise from academia, around the world, coming on site. For other projects I lead, we do a lot of large scale partnerships. And often, like for example, with the Lyme disease, and we have a $25 million Lyme Innovation Accelerator. Many in the Lyme community do not trust government. They think that the medical guidelines are failing them, and we in government have been very slow to acknowledge the problem and their suffering and pain while they fall between the cracks. The frustration and anger builds. So we didn't have credibility to work with this community. So what we did there was really to find out who was trusted in the community, and then work with those people to co-create events. We literally had a series of events over several years where the community leaders and influencers would tell us what they needed, and we would work around that. So we've built this up over time. But the model used there was very much one that, and I think Michele said this, like, we're not just government here to help, but recognizing that we can do all the talking in the world. And if communities or people don't trust us saying trust us will not help. So often what I recommend, and I think it's a strategy that works well in many contexts, is identifying who are the influencers who are part of that community and have been for decades. USDA does this really, really well with their cooperative extensions and people who are embedded in the community and work in, with the agricultural parts of that area. So they're not swatting new people in. It's like they are the community. So there are many, many different models out there, but find those people, and whether they're in government, whether they're nonprofits, whether they're outside groups, then the role of government becomes seeing what they need, find out what's working, and often lifting that, putting a spotlight on it so other peers can learn from that and getting out of the way. So it's almost like we're a spotlight and a bit of a matchmaker and can create, the opportunities for the peer-to-peer learning. And then the groups in the ground who have the ear of the community, the trust of the community, a lot of the solutions come through them. So it's a long-winded way of saying yes, but how we work with the nonprofits varies. And in cases where there's limited trust, then I find forcing it from the top won't help. Figure out who is trusted and then create value for that organization so they can better deliver on their mission. And often that is us putting a spotlight on what works, helping them with resources, giving them a national platform, whatever it is, and getting out of the way.
Wow, these panelists are so great. I want to be mindful of time. We're at 1:01. Kristen, Michele, do you have time for one more? Okay, all right. I believe we had one more question. Dan, did you have your hand up?
Yeah, thanks.
Great.
I'll try to move quickly, and actually the last answer sort of touches on it, but I really appreciate what you said about recognizing that, if you're the government, you start with a perception and a reputation with people, particularly when it comes to reaching the most vulnerable audiences. And I wonder if you could talk about, I think there's a tendency in government to not start from there and to think you can just start from wherever you are and begin talking to people or introducing services. I'm wondering if you can talk about the best methods or tools you've seen to assess kind of where you're starting as a brand and the brand of government with a particular audience or particular community, and bring that data back into the federal agency so that you can level set that understanding for sort of everyone who touches a piece of service delivery, not just kind of for you.
Yeah, that's an awesome question. And a quick answer, I'll throw it in the chat right after, is we had a bunch of human-centered design approaches where we did listening sessions, interviews, rolled it up into kind of archetypes, personas, and then journey maps, and would layer those onto where levers of influence are at the department. So what does the community say they most need? And then layer that into what are our points of influence and prioritize that way. We kind of coined this method called Health Plus, and I'll drop it in the chat. But we've done that for sickle cell. We did it for Indian Health Services, IT modernization. We just finished up for Lyme disease. And so that approach of getting out there, I mean, each one of those takes hundreds of hours and all, but it is so worth it. And then out of that, you don't have hundreds of anecdotes. You have all these anecdotes rolled up into like something concrete that then becomes data government can respond to. So the system we've come up with after many years of going in circles and starts and fits was the Health Plus model, and it rolls up a lot of human-centered design to give concrete deliverables. But then I found at HHS are easier for policy and decision managers to work with. So I'll drop that in the chat, and over to you, Michele.
Thanks. I think I'll take a different angle. One of the first places at HUD that we thought was valuable to have this conversation about who are we to communities and how do we support is who are we to ourselves, right? Having the experience of working at VA with Lee during a very challenging time with respect to employee morale, confidence, the correlation between the employee experience and the direct impact it had on patient outcomes. That taught me so much about my own personal journey and why the role of, administration and personnel, HR, infrastructure, camaraderie, like all of those pieces play a significant role. So what I would tell you is, in order to be able to, from a united front as an organization, to step out into the community, we've actually taken the time to pause and reconsider where we are as an organization. When we're asking our staff to lead and launch these critical initiatives, are they comfortable? Do they feel safe? Is there a place for them to share their own experiences, their ideas, their recommendation that can actually enhance and push our programs in a way that is more meaningful, purposeful, and beneficial to the communities that we serve? And honestly, to what Amira was mentioning at the start of this conversation, yes, there's a moment for us to really reassess who we are to community, what information we've already collected, where groups have already been organized, where there are groups that are not organized, and what mechanisms do they have to come to our front door? Do they even know where the front door is? That requires a level of assessment to sort of get to where are we now. But I would say to you, there's an equal and more significant investment to prepare our workforce to go on this journey with us, because it's not something that's going to be accomplished in a year and 2 years and 4 years. Like, this is a long road ahead, and we need to ensure that our entire workforce understands what equity means, how we define it, how we reach out to community, how we interact with community. Because if we can't start from that place, then we're compromised even before we've begun this journey. So we are definitely investing time and energy to ensure that our workforce, where we are with our brand, with our workforce, that they feel valued and respected, and most importantly, safe. That's a level of effort that we've begun and will continue to engage as part of our equity transformation.
Thanks for going into overtime for that. I appreciate it. That's great.
Thanks for the question.
All right, everyone. So we have 24 minutes left. We can spend this time networking, chatting, however you would like. But I think before that, why don't we throw, a round of applause or some sort of emoji in the chat, thanking our amazing panelists. I think someone mentioned this earlier in the chat, just how great of a story that this is. And gosh, I'm sitting here wondering, why is this the first time I'm hearing about this? This should be like blasted from any sort of virtual speaker, real speaker, wherever. Like, this is such a great story, really energizing and inspiring. And I'm so glad that you were able to come here today and share it with us. So thank you so much.